just want to show you, just FYI, because we're talking about blood-borne illnesses and we were talking about HIV and the spread of HIV yesterday, I just want to point out something on this chart right here. This chart is just as we talk about how prevalent HIV is, you know, every 9.5 seconds somebody contracts HIV. This is probably why. This is an exposure chart. If every person has only the same number of partners as you, so if you have one partner, then basically, because when we say exposed, you have to remember that if no protection is used, you're talking body to body. And if the same thing happens to the person that they used without, did not use protection with before that, and back and back and back. So basically you've exposed yourself to all those people that they exposed themselves to without using protection. So if everybody had the same number of partners as you do, you had 2 partners, then basically, and this is exposed, then basically you've exposed yourself to 3 people because they exposed themselves to 2 as well. You can look right here. If you had, and this is over a period of time, not like all at once. I'm just saying. 4 people who had unprotected sex with 4 people, then, and you had sex with them, unprotected, then you basically have exposed yourself to 15 people. And my question to you is this. Do you know those people? Because that unprotection exposure passes down from all these people before you to the person that you just had unprotected sex with. So the bottom line is, you know, if you had 9 partners and they all had 9 partners, you exposed yourself to 511 different people because that exposure with no protection is passed from body to body to body to body to body. Does that make sense? You don't know those 511 people. You don't know what they've got or where they've been or what they've done. If you have 12 partners over a period of time and those partners all had 12 partners, you've exposed yourself to 4,095 different people. Most of which you don't know what they've done, what they've had, what they've injected, bottom line, you just don't know. So when you do not, and this right here is the reason that our statistics are mostly why our statistics are what they are when it comes to passing down these diseases. And this is why you have to protect yourself. The rule is, starting today, you have to assume that everybody all the time is infected. That's the way. If you keep that in your head, that's the way to keep yourself protected. Assume that everybody all the time is infected. And you'll see that in the book. That's what we call a standard precaution, and that's what we're going to talk about today in just a few minutes. So I just wanted you to be aware that that exposure is how we pass things down and why our statistics are the way that they are. I said yesterday, I think we're getting better about it with education. This is part of that education, and hopefully you'll remember that. But if you don't remember anything else from today, I hope that you remember that you need to assume that everybody all the time is infected with something, not just HIV, but with something. That way, you will stop and think before you do something stupid. Just saying. All right, on your yellow chart, let's move on. We are going to talk about the other 2.
Did you turn lights on?
Yes. Jay, you can turn a couple of lights off. Leave one on because it's really dark in here when you don't.
That's okay.
Well, it's not for these people over here. You got some light, but they couldn't even see first period. Turn a couple of them off. So, hepatitis. There are different strains of hepatitis, just like there are... That's good right there. There are different strains of hepatitis, just like there are different strains of the flu, different strains of herpes. The bottom line is, when we talk about a strain, we're talking about this. You got the original, which is like the parents. And then if you've got hepatitis A, B, C, D, E, and F, they're all brothers and sisters of these parents. They're all hepatitis, but they all got a different name. Similar characteristics, but a little bit different. Just like your parents and all your siblings. Basically, that's how that works when we talk about different strains. So today we're going to talk about hepatitis B. It is what we normally call HBV, not HPV. We're not talking about human papillomavirus. That is something to be concerned about. Fastest spreading STD that we got going on right now. But we are talking about HBV, hepatitis B virus. Because it's a virus, we cannot kill it. I will say this, you don't have to be too concerned about it because you were all vaccinated against it as children. Although I will say this, I had a girl in my first period class just a minute ago. She was absent yesterday. She went to the doctor. They said they're going to start giving another round of hepatitis B vaccines to your age group. I mean, I don't know, and she really didn't. She had them as a child. She doesn't really know why, but she had one yesterday. It's a round of 3 injections. She has to go back. You have to go like 3 months in a row to get it. So they are probably the next time you go to the doctor, they probably are going to suggest that you get the whole round again, which was a surprise to me. That's the first time I've heard that. Bottom line is, you have been vaccinated against it, so you basically don't have to worry about it, but you still need to know about it. All hepatitis affect the liver. What does the liver do for your body? Couple things. It does. It filters the blood. All the blood filters through the liver, and the liver filters out impurities. Okay? The biggest thing that you need to know about what the liver filters out is alcohol. The liver filters alcohol out. But it can only work so fast. For every alcoholic drink that you drink, and it doesn't matter if it's 1 glass of wine, 1 can or bottle of beer, or 1 mixed drink, or 1 shot of alcohol, any of those things, it takes the liver 2 hours to filter out that 1 drink. So within 2 hours, if somebody's drinking and partying, they're probably going to drink more than that 1 drink during that 2-hour period that the liver's filtering out the first drink. So the other 2 drinks that they may take in during that period of time, what's happening to those 2 drinks? Because the liver is still filtering out the first drink. Now you've taken 2 more drinks in that 2-hour period. What's happening to those? They are in your bloodstream and affecting your brain because the liver can't filter them out any faster. The problem with that is that's what causes you to be drunk, is the fact that the liver cannot filter out the alcohol fast enough. But the body has some mechanisms to help it. That's why when people drink alcohol, they vomit. That's why they have to pee all the time. That's why they throw up. Because the body is basically saying, get it out, get it out, get it out, get it out. Alcohol does affect the liver, and it does cause cirrhosis of the liver, which hardens the liver and makes nodules on the liver so that it can't filter. You cannot live without a liver. You can live without a lot of things, but you can't live without a liver. Some people say, some people say, well, I'll just get a liver transplant. Well, I can tell you right now that the chances of you getting a liver transplant, if you were to ruin your liver with alcohol, where do you think you're going to be on the list for a new one? Yeah. I mean, you ruined the first one with alcohol. What are you going to do? Get a new one and ruin it too, and somebody else die? I'm just making a point here that the liver, you need to preserve your liver because you only get one for your whole life, pretty much. Okay? So this is blood-borne. You're going to get it but here's the other thing too about hepatitis. It's a whole lot easier to get hepatitis than it is HIV. There are only 4 ways to get HIV. There are more than 4 ways to get hepatitis B. Okay? Now let me say this. There is a hepatitis A. The reason we're not talking about hepatitis A is because it's airborne. You get it from people coughing, sneezing, drinking after somebody, eating after somebody. It's really easy to catch. And it's very, very contagious. It too does the same thing. They all attack the liver. They all turn you jaundice. We'll talk about that in just a minute. But we're not talking about it because it's not bloodborne. It's airborne. All right, so let's look at this. Prevalence. 800,000 to 1.4 million cases in the United States, most of those unaware. Now, why is it that people are unaware that they have any disease? Any.
Because symptoms don't show.
That's right. They got no symptoms. They got no symptoms. By the way, there are a lot of STDs out there that have no symptoms. Gonorrhea, no symptoms. Chlamydia, no symptoms. Boy, you can pass that stuff around really quick. You got no reason to believe you're sick because you've got no symptoms. So most of those people are unaware. 5,000 people die of liver problems associated with HPV every year. And you may say 5,000 is not that many. And we're talking about in the United States. It isn't. But it also is avoidable. So even those 5,000 should not die. That does not mean that those other, 900,000 people who have it are not struggling and suffering, because they are. One of the reasons not so many people die and we don't have as many cases is because the younger population has already been vaccinated. My age group did not get vaccinated. I didn't get it until 1991. But I was an adult. You got it as a child because it was already there for you. So some of the older population of people didn't get vaccinated against it. Okay? Transmission. Blood, obviously, and materials contaminated with body fluids. That would be mucus. People who have sinus infection and spit up bloody mucus. Vomit that may have blood in it. Feces that may have blood in it. Obviously, semen, vaginal secretions. You're not going to get this from tears or sweat or probably urine. That's not the kinds of, those things don't have mucus in it. Injections. If you use, if you're a drug user and you share needles and one person is infected, lots and lots of drug users have hepatitis B and C because they share needles. Because most of drug users don't work and they don't have any money, so they share needles. And it's really rampant among drug users. Any mucous membranes, which we just talked about. Any sexual activity, which we talked about. And mothers to babies. It is much easier for a mother to pass hepatitis, whichever kind they have, from mother to baby at birth than it is HIV.
Which is more dangerous than
Well, all three of these are deadly, so hepatitis B and C can be treated probably easier than HIV. So I would say HIV probably is still going to be the most dangerous if the baby gets it.
If a baby has HIV, doesn't that mean its immune system is even worse than it is?
Oh, yeah. Okay, here's the problem with the hepatitis viruses. They can live outside the body in dried body fluid for several days. So let's say, for the sake of athletes, football player gets his, lip busted, goes to the locker room, uses a towel, has blood on the towel, lays the towel down. I'm sure that you don't do this, but I'm just using this as an example. Blood dries on it. If he's infected, there's infection in the blood. It's dried, laid there for, several hours. Somebody else comes in and picks the towels up. But again, you would have to get the bloody part of the towel onto a part of you that has an open wound for that to occur. If you just, dried your arm off and you got no open wound, again, it's got to get into the bloodstream for that to happen. But the fact that it can live outside the body in dried fluid is different than HIV. HIV needs that live host for it to continue to live. Okay? Signs and symptoms, most of the time none. When it first starts, and by the way, this can go for long periods of time, just like HIV, no symptoms. When symptoms do, and they will eventually show themselves, when they do, it's going to be a loss of appetite. It's going to be fatigue. a mild fever, not a raging fever, just a mild 100, 101. Muscle aches and joints. Stomach pain. And jaundice. What is jaundice? Right. It's where the skin literally turns yellow. The whites of your eyes turn yellow. And that is pretty much the telltale sign. Because if you take the jaundice off and you just go to the doctor with those other symptoms, that could be many things. But you add the jaundice. The only thing that causes jaundice is going to be hepatitis. So they see your skin color, they know immediately what's wrong with you. Now, where have you heard of jaundice in another situation? Babies. Sometimes babies are born with jaundice because their liver hasn't fully kicked in and started filtering the blood yet. What do you do for babies who are jaundiced? And by the way, they do not have a disease. It's just that their brand new little bodies hadn't fully started functioning yet.
Wait, so they don't have this disease?
They do not have it. It's just that their liver hasn't started filtering yet. It's brand new. Everything's got to get going, you know. So you what?
So is it like
It is not. It's actually, you put them under a UV light. In the hospital, if they're jaundiced, they put a little light underneath their little bed, little bassinet thingy. And when you bring them home, they'll tell you to put their bassinet or their crib like by a window right there so that the UV light can go on them. Because what that does is it helps the liver to kick in. And usually within a couple of days, they're fine. If they're not, you have to take them back to the doctor and they may do something a little bit more. Sometimes they'll put the light on top of them. You don't put them directly in the sunlight, but you do put them in the light so that that UV can help the liver to kick in. They do not have hepatitis. It's just that this is all about the liver. Okay? And by the way, another thing that you'll notice that will happen with this, and this is kind of gross, but you need to understand it, is that your urine, for people who have start with these symptoms, they start to turn jaundice, your urine will turn brown. Bottom line is, if you're well hydrated, your urine should be clear. If you are well hydrated, most of us, unless you're on some medication, a lot of medications will turn your urine different colors. But for a person who is just initially infected with hepatitis, the urine will turn a darker yellow, and then it'll begin to be orange, and then it'll turn brown. Okay, you know what? By the time your urine starts to turn orange, unless you're on a particular medication where the doctor tells you, don't be shocked if this happens, your urine starts to turn orange or brown, you better be at the doctor because you know something is not right. Because that is not right. So that is another symptom as well. Testing, jaundice is yellowing. We know that. Testing, blood work. Now, you don't have to wait 6 weeks, 12 weeks, 6 months to find the answer to this. Okay, this will be obvious. Blood work. But the truth of the matter is, they're probably going to find this out by looking at you. Honestly. Unless you go before you start, you go just because you don't feel good. Before you start being jaundiced, then they may not be able to recognize it just from looking. Prevention, same precautions as with HIV. You're going to take the same precautions. You are going to get a vaccination, which you've already had. So this really is not a substantial issue for you. Obviously, no matter what, if you just insist on having sex, at least protect yourself. And do not use intravenous drugs. No shooting up heroin. And if you absolutely insist on doing that, at least get yourself a clean needle.
Oh my God.
There goes my weekend activity.
I know. I'm sorry. I'm sorry. If you just insist, at least protect yourself.
Okay.
Say I have a friend who does this. Where do I tell them to get a clean needle?
CVS.
Actually, you can't just buy needles. I think, don't you have to have a prescription to buy hypodermic needles?
Oh,
You can't
probably
just
why
go
they
buy
just
'em.
keep it.
Yeah, oh, that's exactly
Why
why.
not just take like a baby?
Because you cannot guarantee in that little teeny tiny
Boil
needle.
it.
Can't do it. Can't do it. All right, so let's look at hepatitis C.
Hep C.
Yes. Do you need to go right, isn't it? Go. Okay, hepatitis C. Now, I will say this. You probably have not been vaccinated against hepatitis C. It is a fairly new vaccination. What I do not understand, it does pretty much the same thing. Again, they are just brothers and sisters of the hepatitis virus. I don't understand why they're not requiring a hepatitis C vaccine like they do B. I don't know. I don't get it. Some doctors, when you go into just for a regular whatever, they will say, do you want a hepatitis C vaccine? If you go to the doctor and they offer it to you, you do. Take it. But I don't understand, because you're going to see right here, more people have hepatitis C than HIV. Yeah.
What's worse?
Well, I will say this. Well, hang on just a second. 25,000 new cases each year. 3.5 million people. That is almost 3 times the number of people who have HIV have Hep C. This is a big deal. A big deal. And it's much easier to transmit than HIV. Which means to me, why would you not require all kids who go to the doctor to get a Hep C shot? You got a B shot, why can't you give them a C? I need to do some research on that and find out why they're not requiring
There's got to be
a
a
C.
reason.
What?
So there's got to be some.
There has to be a reason, but for the life of me, when you see how it's transmitted, and you know that it's easier to get than it is, and look at how many people have it. How can you look at that statistic and say we don't all need to get it?
Is it new? Maybe like
It is, well, I will say this, it's fairly new, probably in the last 10 years. And I will say this as well, because transmission, mostly it is through IV drug use. Most of hepatitis C infections are caused by IV drug use. I have actually 2 friends, both of them male, they are my age, and who have the last probably 3-4 years been fighting hepatitis C and only recently found out they had it. How did they get it? Because back when they were teenagers, which was in the 70s when we were teenagers, intravenous drug use was very popular. We didn't know anything. You have to remember that even HIV was not understood and known anything about it until 1983. I was an adult and married and had a kid by then, before we knew anything about HIV. It still existed. We just didn't know what it was. Well, the same thing with this. So these kids are all partying and shooting up and whatever, and sharing needles because, again, you can't just go get them. So it took all this long because there's no symptoms for the longest period of time, and only in the last 5 years, both of my friends have had liver issues. They have been fighting it. As far as I can tell right now, as far as I know, information-wise, they both are, quote, hepatitis C free. So we do have drugs, but it has not been an easy battle. It has been, the medication for it made them both deathly ill, kind of like chemotherapy does, deathly ill. And they understand, the choices that you make today, you got to live with tomorrow. So they didn't know. But they'd tell you in a heartbeat. It's not anything to play with. Yes.
Okay, so say you have hepatitis C or B or whatever, and you get it at an earlier stage. If you get the vaccination, could it even out, kind of? Like if it...
No.
You can't?
No.
If
No.
you have it one time, can you get it again? Like once they get rid of it, can you get it again? Like a flu or something?
I'm not sure. I'm not sure if you can get it again.
maybe they don't give you vaccinations because it's an insurance problem. Maybe that vaccination is a lot more expensive to where insurances don't cover it.
Wouldn't you rather pay for a vaccination? If you were an insurance company, wouldn't you rather pay for a vaccination than the hundreds of thousands of dollars that it costs to treat that person if they were to get it?
That's true.
That's what my insurance did with in 1991 when they came out with the hepatitis B. My insurance said you either get the vaccination Or if you contract hepatitis B, we won't pay for your treatment, period. They wouldn't pay for the treatment. Who's not going to get it? I'm going to get the vaccination, of course, for more reasons than that. But that is not the reason, because it costs hundreds of thousands of dollars to treat somebody with hepatitis C. And if I'm the insurance company, I'll pay, even if it's a $200 vaccination, I'd rather pay $200 than $200,000 to treat that person. So you can't go by that, Lauren.
Like, I don't know, I guess this could be a possibility. I don't remember what vaccine it was, but I know it was like, I'm pretty sure it was a while ago. Like, it was something against, I don't really remember what it was, but like, there would be other issues possibly associated with after they did get the vaccine.
Was that Gardasil?
I can't tell you, I don't really remember.
It's probably
But
Gardasil.
maybe like that could be an issue or something, why they don't really advocate it.
Nope. There shouldn't be any side effects or anything. Gardasil, if you're talking about Gardasil, that had side effects. All right, let's go on. The other reason, the transmission, tattoos and body piercings. There was a time where getting a tattoo or getting a body piercing, people just did it at their house, you know? And some of them still do. But if you go to a business type, it is now regulated by the health department. They come and check to make sure you have sterilization equipment, that you have brand new needles. Every time you do some of this stuff, you open up a brand new package. But there was a period of time that a lot of people were getting this done. You know, I don't want to say on the down low because that's not what it was. It's just that you went to somebody's house and did it. And you didn't even think that there could be infection of any kind in the needle. You didn't even think about somebody else. They used it on somebody else. They may have wiped it off with some alcohol. That doesn't kill everything. So it was a big deal. Now they are very strict at all your tattoo parlors and piercing places. The health department comes in and checks to make sure you're sterilizing everything. You're opening new needles all the time. So it's not as much of an issue, but it has been in the past. And you're going to get it from any direct contact with infectious blood. And that's where you come in as first aid. You come in with, you know, at the scene of an accident where somebody is bleeding or whatever. Not so much these other things through first aid, but just infectious blood material. That's what you have to worry about. Signs and symptoms are the same as hepatitis B. Probably for years there could be none. But that does not mean that that you're not contagious and you can't transmit it to other people, because you absolutely can. Again, it's going to be fatigue, loss of appetite, weight loss, abdominal pain, loss of concentration. I look at some of you and wonder. Just kidding. I know it's because you partied all night.
Oh, yeah.
On a
Partied it
Wednesday.
up on a Wednesday night.
Come on, the dudes, who does that?
Who does not do that?
Who does that?
I don't know. You tell me.
I can tell you I didn't do that.
I was at the bar.
Okay, these are all the symptoms. And then lastly, of course, is jaundice, which is going to be your number one indicator.
So that comes with hepatitis.
Any hepatitis, A, B, or C.
That would freak me out if I woke up and my skin was yellow.
Yeah, and I've seen, actually, my mother had hepatitis A. She got it from a restaurant.
Yeah, what's the difference between Hep A, B, and C?
A is airborne.
And that's curable.
Can it be
or no?
curable?
My mother was in the hospital for 6 weeks.
God, I would have sued.
And I could not go in because it's extremely contagious. I could not even go see her. For 6 weeks. And as a matter of fact, I was pregnant with my daughter, and she got out of the hospital about the time that my daughter was born, but she could not even come see the baby for 2 weeks after the baby was born. And as a female, you want, the one thing that you want is your mother there when you have your baby.
All right, and my question is, how did the doctors not get it?
Yeah.
Well, because they wear protective equipment when they go in and deal. They wear the gloves, the mask, the gown, the booties, the hat, the whole thing. Huh?
I would be so offended if someone had like a straight up mask. Like,
Oh, are you kidding me?
like
They do that. You do it all the time.
No,
Yeah.
like a
With
big,
those suits?
like a big.
No.
Oh, like one of the, I thought you meant like a big head.
No, not like a hazmat. Not a hazmat, you know. We're not it's not quite to that point yet. Yeah, no. Okay, testing, blood work, once again. But again, you don't have to wait, you know. I mean, you have to wait a few days. All blood work, you have to wait a few days just to get the results back. But you have to wait 6 weeks.
Are you talking about like one of those just like little white faces?
Yeah.
That's it?
Yeah.
And that protects them from it?
And gloves. Yeah, I mean, that's the best you can do.
Like at Publix or something.
So
Or like
you
at
don't
like
Well,
Disney and
do
stuff,
For,
or-
yes, and it might depend on whether they have been infected and don't want to infect the public, or they may have a low immune system and they don't want the public to infect them. That's the reason that they do that. All right, prevention, we got to go. Prevention. There is, I say there's no vaccine. At the time I made this PowerPoint, I did not find indication, but since then I have found indication. I just don't understand why they're not giving it as prevalently as they should. Same as HIV, basically. Barriers.
Wait, so should we write that there isn't that?
Well, it doesn't, I mean, you can put a question mark beside it, and we'll do a little bit more research on that. If anybody goes to the doctor in the next, little bit of time, ask about the hepatitis C shot.
Is there a vaccine for hepatitis A? Like,
Not that I know of, but that does not mean it's not out there. If it is, it's like C, and it's not required. Barriers, again, against blood. This is your gloves. Anything, we're going to talk more about that. Again, avoid your IV drug use. And do not share. Now, here's the thing about hepatitis B and C. Yes. Okay, so again, you're talking blood to blood, but it's different from HIV. Okay, there's only 4 ways to get HIV. With hepatitis, you can get it from, if you were to, and I know it's gross and nobody would do it, but who knows, using someone else's toothbrush. You brush your teeth, your gums bleed, their gums bleed, that blood is passed. Razors. Now, I don't think it's all that uncommon, particularly that somebody might borrow someone else's razor.
That's really uncommon.
Okay, well, maybe. Maybe for guys, but necessarily for girls it may not be. Again, you nick yourself, you got a little bit of blood on that razor. And guys, listen, when I say it can be blood, there can be blood on there and you can't see it. There can be particles of blood on there that you can't see. And that's the reason that for the needles, you inject something into yourself, you think that the stuff is going into you, but there's going to be inside that needle a little bit of blood that you even cannot see. It happens all the time. So even on a razor, we're not talking about a big clot of blood on the razor. You won't be able to see it. Chances are you won't be able to see it. So anything, again, towels, mouthpieces, anything that could possibly get blood on it.
So can't you say the same thing about a cut? It could be like such a small cut you can't see it.
Yes, absolutely.
So you never know if your skin is pierced.
Remember, assume that all people, all the time, are infected.
And assume that you at all times have a cut on your skin.
No, not necessarily. Not necessarily.
I mean, but now you're freaking me out. Like, I thought I was going to have a cut on my arm and not even know.
I know.
No. Okay, yeah, right. Okay, turn in your book to page 18. Let's just look at this. When I was saying just a minute ago, assume all people all the time are infected. That I want you to get in your head. That is what we call universal precaution. Universal. Assume all people all the time are infected. So, you come to the scene of an accident, or somebody is, they fall and they bust their head and there's blood. Or they're bleeding they fell and busted their teeth and there's blood. Or whatever. Or you're having unprotected sex. Assume all people all the time are infected. What you have to do is protect yourself. Listen, no one else is going to protect you when it comes to this stuff. You're going to have to think to do it yourself. Look down in the middle of the page at the bullets, the little bullets. Use personal protective equipment, and actually that was a question on your test, PPE, personal protective equipment. If you do not have medical gloves with you, put your hands in plastic bags. So if you've got Walmart bags or whatever, that's better than nothing. If you have to touch somebody, any kind of baggie, a baggie, lunch baggie, or take the dressing, like the gauze pads, put it in their hand and let them hold it on their own wound. That's the better thing to do anyway. Wash your hands with soap and water before and after giving first aid. Now I'm just going to tell you straight up, If you can't always do that before giving first aid. You can't always wash your hands before you give first aid. If you got gloves, throw them on there. But if you can wash your hands, then do it. Definitely afterwards, without a doubt. Now, I'll throw you for a loop here. Do you think that it is better to wash your hands with soap and water than to use hand sanitizer?
Yes.
No.
What?
You'll see a video tomorrow when we do the whole hand washing thing from the safety agencies that say that alcohol-based hand sanitizer. I would have said the same thing as you. I totally would have said the same thing as you. Because my thought is, if you wash it, you at least wash it off and down the drain, right? Hand sanitizer, you do this, but it stays on your hands, right? So I would have said the same thing. And when I saw this video, I'm like, you've got to be kidding me. Now, I will say this. Some hand sanitizer, like some of the hand sanitizer that you buy at like Bath and Body Works, I call it foo-foo because it just smells good and whatever. That does not have as much alcohol in it. It needs to have like 99.9% alcohol. That does dry your hands and it does make them crack if you use that all the time. But you look, any hospital, doctor's offices, dentist offices, they generally have those dispensers on the inside and outside of your rooms. And that's the first thing they do when they come and when they go. They don't always use the whole soap and water. A lot of them have those hand dispensers so that they don't have to touch anything and they don't have to get their hands wet. I'm just saying, you'll see it. Keep a barrier such as gloves or a dry cloth between body fluids and yourself. Cover any cuts or scrapes on your skin with protective clothing or gloves. Do not touch your mouth, nose, or eyes when giving first aid. Don't eat or drink or smoke because anything you put close to your mouth is going to be a risk. Don't touch objects soiled with blood or body fluids. Towels, T-shirts, washcloths, gloves, anything that's soiled with any of that stuff. Don't touch it. Assume it's infected. Be careful to avoid being cut by any sharp object at the emergency scene. Use absorbent material to soak up blood or body fluids and dispose of it properly. Listen, even things like paper towels. You don't use a washcloth or a towel. Now, if that's all you've got to stop bleeding, to put pressure on, then absolutely. But to clean up a mess. You know, for example, if you fall, like the chick did in my room last year and busted her mouth on the floor, I'm not going to get, my jacket or a towel or something and wipe it up. It needs to be something that can be disposable, unless I'm going to throw that away. Disposable. Paper towels. Clean it up with a paper towel. And then you don't put that in the garbage can. You don't just put that in the garbage can. If it's got blood or bodily fluids on it, you put it in another bag. And depending on if it's blood, if you've got biohazardous waste that can take it away, then that's what you do. But you don't use, unless you're just absolutely, not going to use that article again. Use something like a paper towel. If you have commercial disinfectant, like I have at my house, I use Clorox bleach spray, and I spray it especially around my kitchen sink where I cook with food and stuff because I don't want any cross-contamination. Then you can spray that on blood or bodily fluids that may be on the floor if somebody were to fall and they cut themselves or whatever. If you don't have that, and this was a test question, a mixture of water and bleach, 10% bleach, 90% water. It doesn't take much bleach. So if you've got a jar, you fill it 3/4 of the way with water, the other fourth with bleach, mix it up, and you can use that with paper towels to clean it up. That's if you don't have some commercial type, okay? If you're exposed to a victim's blood or body fluids, wash immediately with soap and water and call your health care provider. You need to call your health care provider. I told my last period class, had a friend who wanted, bless his heart, went for a long time, didn't know what he wanted to do, didn't know what he had, little jobs here and there, and finally decided he wanted to be an EMT. So he put himself through school, which is only like a year, maybe 18 months. First day, this is no lie, this was in Austin, Texas, when I lived in Texas. First day on the job, car accident. Go to pick up a guy, put him in the ambulance, and he's my friend, is working over him. Kid's got blood all over his face. And out of nowhere, and Brian doesn't have anything, any protect. Now, they even have those face shields that are clear, you know, they cover the whole face. He didn't have that on, because a lot of times you'll see, like in movies, they don't wear them. They wear them like in operating rooms and stuff like that. They ought to wear them in ambulances. Because what happened was, he was leaning over the kid, working on him, and the kid started coughing up blood and coughed it in his face. Got in his eyes, got in his mouth. Come to find out, this kid had hepatitis C. He was devastated. Devastated. So he went through a series of testing. There is an antiviral medication that you can take. They don't guarantee that it will work. Sometimes it does, it doesn't. So he did go through a series of testing for a while to make sure that he didn't contract it. And fortunately, he did not contract it. But that right there is enough to scare you to death. Because he easily could have gotten it. Easily could have gotten it. So again, you have to assume everybody all the time is infected because you don't know. You don't know.
Neither do they, apparently.
That is correct. Out of 3.5 million, most of them don't know they're infected because there are no symptoms. That's the scariest part of this whole thing. Dylan.
Did the hospitals pay for the treatment?
Actually, they did. Actually, they did. The company, well, I don't know if he worked for probably the county. You know how our firefighters, paramedics work for the county. They probably did.
It's like super off topic, but where did you go to school?
Where did I go to college? University of West Florida in Pittsburgh. All right, so now you know. Those are your bloodborne illnesses. Assume everybody all the time is infected. Questions? Comments? Scared?
Yeah, that's all you do in this class.
Yes, my job is done. Yes. All right, I need you to put the books away for me, please. Oh, yeah.
I'm gonna go there. I'm visiting Texas for my Thanksgiving. Really? I have so much family there, like in Texas and Minnesota. Like my mom's side is all in Texas. I'm like that family so much. I spent half my summer there. Not last this summer, but the summer. Dallas, Plano, Waco, Hillsborough. Hillsborough so far.
Yeah.
And then my cousin went to Boston, and then my other cousin went to A&M, and then one of my other cousins went in Texas, I love it there. I went there over summer, and I passed by this place. It was like Sally's hair salon and chainsaw repair. Like only in Texas though, like real though. It's like it just made me laugh. I was like, that's so
yeah. Yeah.
And my mom grew up there, so
We lived there for 7 years and
yeah, I visited.
they are so great.
Right, everybody's so much nicer.
Unbelievable.
Seriously.
Yeah. So tomorrow we're going to do gloves. I'm going to give you gloves.
I need like a couple
I found it in my bag.
Horrible. 45.
Chad, where are you? This is yours. It needs to be in the tape fast so you find
MTMR.